Hello, watching News First Prime. I'm Rahul Dayan. You're here at the Path to Parenthood event today in Bengaluru Palace grounds, Grand Castle. And right now, I have here with me Dr. Asha Vijay, Medical Director and Fertility Expert, Garbhagudi IVF. Ma'am, welcome. I think uh, I think a wonderful piece of information was shared by you on stage today, and which is like a wake up call for the youngsters and, of course, people who are facing infertility problems. Right now, if you could analyze the kind of patients who come to you now, because you've got decades of experience in this field. So, before 10 years or after 10 years, what is the kind of difference or the different kind of patients whom you attend at this point of time?
Yeah, very pertinent question. Huh? Actually, a few years back when we were treating infertility, if 10 people walk into our clinic, one or two were infertile. But nowadays, out of 10, almost 5 to 6 are infertile. Either the man is having problems with the semen or the lady is having problems in conception. And one very disturbing fact to our doctors is all the ladies who walk into the clinic with telling about infertility, their egg reserve is coming down very fast. So we are doing lot of researches on why this is happening, why the semen sample has so less count, so less motility, why the lady is having so much of less of egg count. For everything, we are coming to a conclusion that we are getting exposed to lot of chemicals. From head to toe, we are using hundreds of chemicals. All these chemicals are causing lot of problems with our hormonal regulation. So what we call it as endocrine disruptors. And you can see today's youth, they're always exposed to electromagnetic radiation. We don't know what are the side effects, adverse effects of this EMF. So morning to night, even their sleep pattern is disturbed, food pattern is disturbed. Their entire profession starts at 12 o'clock, ends at early morning 6 o'clock. The whole lifestyle has been changed completely. And you know, everybody, even the small baby, is having severe stress, either mental, emotional, or physical. So all these factors are becoming too much increase in the fertility issues in our world.
You just mentioned about three keywords, that is ahara, vihara, and treatment. So that is food, treatment, and of course recreational movement or the activeness which they have to follow in their life. So how important is that at this present age, because everybody is stressed, nobody is like stress free. So could you please stress on the information or the importance of ahara, vihara, and chikitsa?
Actually, ತುಂಬಾ important ಇದು. Now we are becoming so much obsessed with creating wealth and creating name and fame. We have almost forgotten how to eat food properly. So I see people grab a food on their journey to their office or sitting in the car, just having it so in a very fast way without even spending enough time. Now, in our ancient medicine, they used to say, sit relaxedly, pray to God, with a gratitude, eat your food. The entire thing has vanished into thin air now. Nobody thinks of their health, nobody thinks of their physical well being. Everybody is going behind some success, which is a very unknown thing. So it's very important that you pay very much importance to your nutrition, your sleep patterns, your food patterns. All of these are very important. So many people, I ask them, what is the sort of physical activity they do? They say we leave by 6 a.m., come by 12 in the night. Where do we have time for physical health? It's very important that you follow a certain physical routine in your daily life.
And I'm very sure you have treated lot many of patients in your entire experience till now. And could you please share any case studies anonymously, of course, so that the viewers are beneficial by that. After seeing that, even they might come out in the open and say, yes, I need to address this issue.
Actually, when you're telling about the case experiences, I'm remembering one very interesting case where the man had zero sperms. So they have gone to a local doctor, and she has said that you can never conceive on your own. He's so depressed, they have kept the report with themselves and they've never returned. When we did a camp in Kanakpura, somebody brought them forcibly. And then we saw the report, got his hormone analysis done. All his hormones were perfect. And his scrotal scan, testicular scan was normal. Then we came to a conclusion it is just obstruction. His semen production is happening very well and he can be easily father a child. came back to Garbhagudi IVF center, had a IVF. We retrieved the sperms from his testes. Now he has twin, one boy, one girl. That was a beautiful story.
I think it's not just a case story, it's a successful story by Garbhagudi IVF. And one last question, ma'am. So people do think that I eat properly, I exercise properly, I have no habits of smoking or alcohol consumption or anything. But still, some people do need such treatments. Why is that?
See, if I see externally, I may look perfect. So many couples tell we both are very healthy. But internally, how the organs will be functioning, you cannot see it. For example, how your heart is, how your liver is, has to be done by few tests or few scans or MRI. Similarly, fertility, uterus, ovaries, testes, or your tubes, you will not know from the outside. You have to undergo some tests. For example, a 22-year-old lady had come with problem in conception. When we tested her ovaries, it was completely failed. It was a 45-year-old ovaries. So how can you make out from external? You have to test it to know it more. That's the importance of testing.
And I think all such tests and, of course, all such treatments are available in Garbhagudi IVF and, of course, any other IVF center. And that is what is being focused in Path to Parenthood today, which is happening, the summit, which is happening in Grand Castle. Thank you so much. And yes,
Hearty congratulations for this enormous platform, Part to Parenthood, both Wiley and NewsFirst. It's really phenomenal.
thank you so much for talking to us. And we are pleasure to have you here today. Thank you so much, ma'am. So, with camera person Chandresh, this is Rahul Dayan for News First Prime, Bengaluru.